When it comes to the government's preparedness for a pandemic, the question that we are now faced with is what did the government know and when did they know it? And we know a little bit more about what they knew thanks to the work of Ken Klippenstein of The Nation, who joins us now. Ken, welcome back to the show.
Hey, John, good to talk to you.
Good to have you here. You had another great exclusive. You found out information about what the military knew specifically about the threat posed by coronavirus, correct?
Yeah, that's right.
So basically, what did you find in this report you were able to uncover?
What was shocking about it to me was that this report, it was a draft plan for a response to a pandemic event. It was released in 2017, and the plan was shockingly prescient in very specific ways. For example, it anticipated that the leading bio threat that they would face would be from a influenza um, like flu type illness that it describes as being remarkably similar to COVID 19 and its precedent, um, coronavirus. So, not only
Mhm.
did they anticipate that, they also anticipated a lot of the shortages that we're experiencing now. For example, they anticipated that there would be a shortage of face masks, shortage of hospital beds, yep, ventilators as well. And it just goes down the list. They had a very clear picture of not just what would happen, but also how to respond to it. And unfortunately, it doesn't look like that these very clear sort of plans that they had set out were heeded.
Yeah, that's what was so amazing to me about the report was that it was shockingly specific to what we're facing right now. Not only in the sort of thing that would ravage our country, it wasn't, an out of control Ebola or something like that, something unearthed from the thawing tundra. It was basically what we're facing, and their estimations of the number of people that would be affected seem very much in line with what we're hearing right now. I guess the issue is then, does it seem like there was just a lack of interest in it? Did the government think that they were exaggerating? Why weren't we better prepared if this and in other cases it seems like the experts in the room, the knowledgeable people, sort of predicted what was going to happen?
Yeah, when you talk to folks in the military, as I have, there is a lot of frustration because they feel as though this is being characterized as an intelligence failure, when in reality, the intelligence was saying exactly what would happen, and what failed was that the political leadership, and probably leadership at the top of the intelligence community, they weren't heeding these very clear signs.
Hmm.
When I ask why that is, they say that there's a tendency to react to problems in government rather than exercise any sort of foresight, and that seems to be the thought of what happened here. What's interesting about this document is it stresses how important it is to have clear communication and unified, well orchestrated public messaging to the public to get them to social distance and adopt measures that are going to protect themselves from an illness like this. And that is the exact opposite of what President Trump did. You'll recall he described aspects of this disease as a hoax. He tried to blame it on China, and then he said, this is no big deal. And then he says we have to do social distancing. He tweets that in all caps with an exclamation point, I
Hmm.
think. And then after that, he says, well, actually, we won't have to do social distancing for very long because we got to open up business again. So it's just been such a muddled message that this document and the military understood was going to undermine our ability to respond to this in a way that would prevent it from spiraling out of control. And that's what happened.
Yeah. Yeah, and look, I've been incredibly critical, as many people have been, to specifically what Donald Trump didn't do over the past couple of months. And I know that he's been saying he inherited like a broken testing system, either thinking or pretending that he's been in office for a month instead of almost an entire first term. But what I found interesting was that in your article you talk about an individual named Dennis Kaufman, former head of the Infectious Diseases Countermeasures Division at the DIA from 2014 to 2017. He says the intelligence community has warned about coronavirus for at least 5 years. So hypothetically, while it might be a bit of a dodge to say that all of the concerns over testing are just inherited from Obama, that's not to say that hypothetically the Obama administration couldn't have done more to listen to the warnings that were already there.
Yeah, 100%. And that's what folks in the military tell me too. They're appreciative that the public is holding Trump to account in terms of this, but they also say that there is a general lack of support for particularly the medical intelligence side of the military. A lot of people, including me, I don't want to make fun of anyone for not knowing that there was a medical intelligence side of the intelligence community. They understandably weren't aware that all of this, not just sort of planning and response stuff existed, but that we could fund it better. And unfortunately, policymakers have not articulated that to the public. So the sense I get is that generally there is not enough funding for sort of, the saying, ounce of prevention is worth a pound of cure. There was not enough funding for the prevention, and that's how we find ourselves where we are. And that's something that stretches across different administrations. Although, of course, Trump is the most sort of radical example of
Mhm.
not funding prevention.
I'm curious. You said that you've been talking with members of the military. I've seen a few stories about, like, there. For instance, there's, I believe it's the aircraft carrier that right now a bunch of sailors are on, and they're very worried about the spread of coronavirus there. I've seen some reports that case numbers at bases, they're receiving directive from the top to not disclose those numbers. Have you picked up on, from the people you're talking to, any concern that the potential impact on the military isn't being prioritized, or that if it does hit the military hard, that people might not even find out about it, like I guess as part of sort of PR or image control, that infections or deaths among soldiers might be sort of hushed up.
Absolutely. And that's what the military folks are saying too, because unfortunately, in my reporting, I've tried to break down this wall that exists between civilian matters and military matters, because I don't think there should be a wall. I think, they are civilians in the sense that they go home and, have families. And also they, have an effect on the politics of the country. So that's a huge frustration because what you see in the military, as told to me from various Marines, people in the Army, et cetera, is that rank and file, no matter what their politics are, Republican, Trump people, Democrat, whatever, they all are taking, they overwhelmingly are taking very seriously that we need more serious measures to slow this and testing, et cetera, et cetera. And what they're saying is that it's the leadership that is not heeding this. This is a dynamic you see across national security generally, is that leadership is too close to the administration and they kind of become politicized and don't take seriously things that they should, whereas the rank and file deal with it every day, so they understand and are very realistic about what these problems mean. So they are urging me, and I'm working very hard on this to try to get reporting out to the public about what's going on in these things, because they have very few resources. For example, there was a great publication called it was called there was an Army publication that was shut down recently, received DoD funding under the Trump administration, that was defunded, and this was a critical tool. It's called Stars and Stripes. That's what
Yeah.
the website was called, and it explained things not just for the military, but also in terms that the public could understand. Because the military, that's a small, their ability to pressure the Congress or elected officials is going to be limited, because it's just there are a lot fewer of them, and they're restricted from speaking publicly. So those sorts of things are really important, and I hope that this is something that the media pivots to cover more.
Yeah, I hope so too. Thankfully, for now, those soldiers do have you, and that is certainly something.
I'm holding it down.
Yeah, and to whatever extent we can help to let more people know about what you're uncovering, we're happy to do that. For people who want more details, the article is available at The Nation. It's exclusive. The military knew years ago that a coronavirus was coming, and Ken, I know I say this a lot, but great work, man.
Great to talk to you.
Always glad to have you on.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.